Good afternoon. I'm Matthew Cameron, and I'll be your moderator for the COVID-19 update for Wednesday, October 21st. We are joined today by Yukon's Premier, the Honorable Sandy Silver, and the Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is being provided today by Mary Thiessen, and André Boursier from the French Language Services Directorate will translate any questions from French-speaking journalists. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have one question and a follow-up. Before we begin with our speakers, I'd like to verify that everyone can hear us. If any reporters are having a problem, please email Alexis Miller at alexis.miller, M-I-L-L-E-R, @gov.yk.ca. I'll now hand it over to Premier Silver.
Thank you, Dr. Cameron. Thank you, everybody, for joining us here on the traditional territory of the Kwanlin Dun First Nation and the Ta'an Quachin Council. This week, we announced 2 new cases of COVID-19 in Yukon, and this brings our total case count up to 17. While we are extremely fortunate that our case count is so low, we remain in the grips of this pandemic as a nation. In the past few days, there has been 1 new case and 2 presumptive cases announced in Northwest Territories, new cases confirmed in Southeast Alaska, to the south, BC, as well confirmed that it is experiencing a second wave of COVID-19, while Alberta is seeing a record high number of cases, of active cases. These developments are not surprising. As we have said, we are not out of the woods yet. My colleagues and I are still in regular contact with our counterparts in other jurisdictions. Dr. Hanley and his team are also in close contact with public health authorities in neighboring jurisdictions, including Alaska. These conversations are extremely important so that we can continue to share new information and maintain a coordinated response to the pandemic. I know that cases in Skagway have caused some concern here in the territory, but they have not increased the risk to Yukoners. This week, the federal government announced that the non-essential travel restrictions with the United States have been extended until November 21st. This means that individuals can only cross the border into Canada for essential purposes, such as medical services. Regardless of the reason for travel, however, individuals with COVID-19 symptoms are not permitted to enter the country. We support the decision to keep these travel restrictions in place and to keep Canadians safe. Here in Yukon, we are also following the recommendations of our public health professionals to keep Yukoners safe. We remain in a state of emergency in response to the current pandemic. The state of emergency will allow us to enforce the safety measures we have made under the Civil Emergency Measures Act to protect Yukoners. This includes the self-isolation requirement for people entering our territory from outside of BC or the other territories. This week, our enforcement team laid another charge under the Civil Emergency Measures Act for failure to self-isolate as required. Now, this brings the total of charges up to 19. I want to thank our enforcement team. I want to thank them for their efforts to ensure that those entering the territory are informed of the restrictions that are in place. One of them is the requirement to transit through the territory within 24 hours for those traveling to neighboring jurisdictions. We will continue to see individuals with license plates from outside, and most of them have a legitimate reason for being here. I want to remind all Yukoners to please be kind and patient and respectful of those of each other and also of visitors that are entering into our territory. I was very disappointed to hear of the American travelers who had the window of their vehicle smashed in at their hotel en route to Alaska this week. This kind of behavior is unacceptable. I understand that people are anxious and want to keep their friends and family safe, absolutely. It's also extremely stressful to have to travel long distance through different jurisdictions during the pandemic. And as we move into winter, travel is becoming more challenging, and It is also more important than ever that we're patient and we're kind and respectful. We need to support each other through these challenging times. If you do have any concerns, however, please contact enforcement teams. Contact them at COVID-19 enforcement at gov.yk.ca. That's the email address. Or you could also call the 1-877-374-0425 phone number as well. Yukon has a reputation of being a welcoming place, and it's extremely important that we uphold this reputation. When it's safe to travel again, we look forward to welcoming visitors back to our territory to enjoy all that we have to offer. This pandemic has been hard on all of us, including our tourism businesses. Earlier this week, the Minister of Tourism and Culture, Jeannie McLean, announced nearly $3 million in immediate relief for accommodations businesses to top up support provided through existing programs like, for example, the Yukon Business Relief Program. Now, this relief is part of a larger funding package of up to $15 million over the next 3 years for relief and recovery programs for Yukon's tourism industry. Our government recognizes that tourism is a vital part of our economy, and we are committed to supporting it through the pandemic and beyond. Working in partnership with our tourism partners to support businesses will ensure that that when it is safe to do so, Yukon will be open to the world again. Like I said last week, we have done well as a territory, and we've done well as a territory because we have worked together as a territory. Thank you, everyone. Nothing is more important than protecting the health and well-being of all Yukoners and supporting each other through these extremely challenging times. We all have a role to play in keeping the territory healthy and safe, including, again, practicing the Safe Six, washing your hands often, maintaining physical distance, staying at home if you're sick, traveling responsibly and respectfully, self-isolating as required, and also following the gathering guidelines, including limiting indoor social gatherings to 10 people that are not in your bubble. The actions that you take are not only to protect yourself, but they're also to protect your family, your friends, and your neighbors. Please stay vigilant, do your part to support the territory like you have been doing. Again, thank you very, very much for that. I'll pass it off now to Dr. Hanley.
Thank you, Premier Silver. Good morning. Bonjour tout le monde. The 2 individuals diagnosed last weekend gave us pause again to be grateful for what we have in place in Yukon. These cases were 2 individuals traveling outside the territory, including travel outside our BC territorial bubble. They were therefore already in self-isolation back home in Yukon after symptoms occurred. Before their symptoms occurred. And even though the symptoms were mild, they reached out for help, got tested, and took all the necessary precautions. Fortunately, they're continuing to recover at home. Although we received notice last Sunday, by Monday morning, Yukon Communicable Disease Control had done all the contact tracing work, concluding that there was no exposure risk for Yukoners. The contacts remain asymptomatic. These 2 cases raise a few additional issues that I want to speak about briefly. First, I was pleased that the level of public or media concern appeared to be low. I'm thankful that these 2 people have done well, and I'm thankful for your trust in our public health system. Although I wish COVID on no one, occasional cases like these are what we expect to see as Yukoners venture outside the territory, whether inside or outside our bubble. Cases like these are people, real Yukoners, who do require care, contact tracing, and follow-up, but their illness does not pose a threat to the public. So while the numbers of cases are notched up a little higher, the public risk of COVID has not changed, and that is the measure we should be most interested in watching. The mild symptoms that these cases experienced reminds us that most of the time, COVID is a mild infection. But we know that every now and then, especially in people who are older or who have underlying health conditions, it can be severe or even fatal. It's because of COVID's ability to cause severe damage or to kill that we have to continue to take this threat seriously and maintain our public health measures. Part of these measures involves self-isolating and getting tested when you have symptoms. So here's a question for you. What is your plan for when you get symptoms? Are you ready to self-isolate on short notice? What's your plan to communicate with others? Do you have all you need at home while you self-isolate? What support might you need? Do you know who to call or where to go to get tested? It's essential to take all symptoms, no matter how mild, as an indicator that you need to stay home. COVID-19 can present itself very mildly and is not something to overlook, whether you find yourself with a slight cough or an unusual tickle in your throat. If you notice any symptoms that are out of the ordinary, you need to stay home, undergo self-isolation, and arrange for testing. The testing does not have to be immediate. It can wait for the next booking or the next day, unless you are ill and need medical help. But the self-isolation should begin as soon as you recognize the onset of new symptoms. Having a plan in place if you suddenly need to self-isolate offers peace of mind. Even with the mildest of symptoms, it is critical to recognize and react as needed, meaning that immediate self-isolation until you can get tested. Don't try to push through by going to work to finish whatever you're working on or continuing to run your errands. Keep in mind the following symptoms that can occur with COVID-19. Fever, chills, cough or shortness of breath or difficulty breathing, or loss of taste and smell. Remember, those are the red light symptoms on our traffic light model. Otherwise, the list includes runny nose, sore throat, headache, fatigue, loss of appetite, nausea and vomiting, diarrhea, muscle aches. We will have posted, hopefully by the end of today, the traffic light model that we had previously prepared for school and daycare, now also available for adults wanting to return to their activity. Remember that when trying to determine whether to get tested, you can also use the traffic lights for those situations where you just have one or two mild symptoms. Testing is always available when you have symptoms, no matter what. But if you have not traveled, and if you're not a known contact of someone with COVID, and you just have a runny nose or something else that fits the yellow category, then use this tool as well. If symptoms are not in the red category and improve within the timelines written in the guide, then you may be able to return to school, work, or play. But any red light symptoms must be taken seriously. In these cases, self-isolate and either test or do the full 10 days of self-isolation. More information about these and the guides are available on the COVID-19 Yukon.ca website. So that's the advice for what to do when symptoms occur. For those who are planning to travel outside Yukon, continue to respect the rules of travel and travel wisely. I feel we've earned this privilege to travel to BC, to see friends or connect with family, or just to take an Air North special getaway. But we have to keep earning this privilege. Like a prized gift, use it well and wisely. When traveling anywhere, you should take care to respect the public health travel advice of the province or territory you are in. But also think of what you might be bringing back with you. Wherever you are, keep tuned in to what's in the local news about where COVID activity is occurring. When you return, even if you don't need to self-isolate, please lay low. Again, avoid any gatherings that are not within the rules. 10 people inside and 50 outside for unorganized social gatherings. Stay away from others and get tested if you get sick. Use a mask for any setting where you are asked to or when spacing may not be adhered to. Limiting your exposure and reducing your risk is vital to the well-being of all of us. I'm often asked whether the BC bubble should stay open when all of our cases to date are linked to travel. Well, our BC bubble opened up on July 1st, and we have not seen any Yukon cases that we can relate to acquisition in BC. That, I think, is quite impressive and speaks to the success of the arrangement we currently have in place. The rising cases in BC are a call for added vigilance when we travel to and from that province. But we also know much more about where the risks are. Avoiding higher risk settings and activities keeps the risk of acquiring COVID in BC to a minimum. The rise in cases in BC is steady, but as Dr. Henry states, is not exponential. Areas of high COVID activity remain localized and not widespread. The majority of cases can still be linked back to known cases or clusters. All of these are reassuring facts as we continue to observe the situation in BC and continue to collaborate with our colleagues there. And as we look south from our fortunate situation in the north, we need to stay on track with our own safety measures. The risk to Yukoners from COVID does not change with these occasional cases. It is when a case inadvertently shows up at a gathering that we can get into trouble. To stay free from COVID outbreaks, we must keep our social groups small. No indoor dinner parties. Please, apart from ones that are completely within your consistent social bubble. When thinking of your social bubble, remember the following: no more than 10 at a time indoors, no more than a total of 15 in your social bubble. It's essential to consider the gathering guidelines before participating in any gathering that hosts more than 10 people at one time. On yukon.ca, you will find guidance on either attending or hosting a gathering and what the difference is between an organized and a social gathering in terms of setup and numbers attending. Funerals are perhaps the most difficult of gatherings to adjust to COVID guidelines. Most of us have no control over when we die, and who does not want to be part of a funeral or celebration of life for a loved one? But tragically, worldwide experience has also taught us repeatedly that funerals are high risk for COVID spread, in some cases leading to other people getting seriously ill and dying, the last thing you would want when attending a service for someone else. Let's review why funerals are higher risk. For one thing, it may be hard to keep numbers to a limit, as that means turning away people at a time when we are used to welcoming mourners in. Second, emotions are so high, so COVID safety measures may be forgotten or abandoned in the moment. Third, hugging, tears, singing, kissing are all natural parts of mourning a loved one, but all of these are risk factors for COVID transmission. Fourth, visitors from outside the region, even outside the territory or country, may have flown in to say goodbye and join in the service, which could also mean introducing COVID into the event. So please remember, if a funeral or celebration of life or ceremony cannot reasonably be deferred, keep it small and respect the guidelines. They are there so that we can all be protected, most especially our elders and our more vulnerable citizens. If you need advice or help in planning a ceremony, please contact us at COVID-19 Info, and we will do our best to advise and support. We all feel the importance of observing ritual and paying our respect to our loved ones, and we can help you to do it safely. As we approach flu season, I want to remind Yukoners that we have plenty of vaccine and there are plenty of opportunities to receive the flu shot this year. The Whitehorse Clinic at the Convention Centre has been going well. Wait times have not been more than a few minutes, and over 900 people were seen in the first 2 days. The flu shot is prioritized this week for higher risk individuals, but I have just heard they can squeeze other people in who want to get in this week. Officially, the general public clinics start next Monday and run through to mid-December in Whitehorse. You can also book a flu shot this year with your pharmacist. Check the website for specific times at your rural health centre. As for other communities, those vaccines, just like here, have been made available for those at higher risk this week, and then starting for the public next week. With COVID-19, extra measures and precautions have been implemented to limit possible exposure to residents with the flu clinics, and adjustments have been made this year to meet the anticipated demand for the flu shot. Flu shots will be available one of two ways. Again, either through this drop-in at the Yukon Convention Centre or through the direct appointment with your pharmacist. But individuals who can't attend the clinic will be able to, if they cannot leave their residence to receive a flu shot, then they can be accommodated through home care. And home care is also working with continuing care to provide flu shots to those who are residing in long-term care facilities. Flu activity is practically non-existent in Canada at the moment, and that's a good thing during this time of a COVID surge. But we never know what may happen with influenza. It's quite possible that we will see it arrive, if not this month, then later on in the winter or even in the spring. As influenza and COVID have very similar presentations, we really would like to keep influenza out of Yukon as much as possible this year. Remember, if you get any flu-like symptom, you will need to get tested for COVID. If you need a test and you're in Whitehorse, the COVID Treatment and Assessment Centre is going to be your most likely place to get tested. The increased hours of CTAC are part of the effort to boost our overall testing capacity. If you're sick and need urgent help, of course, the best place is the emergency department or your local rural health centre. If you have traveled and if you're a contact of someone with COVID, you may be directed to get tested at YCDC. Either way, to reduce your likelihood of having to make a trip to get tested, getting a flu shot is one more preventative action you can take. As COVID progresses in Canada during this second wave, we can watch from here with some comfort, but also, I hope, with vigilance and respect. Let's continue to take all the precautions we need to. While living with COVID risk and observing the Safe 6 measures, we can still continue to thrive, to work and to play and to socialize from the right distance. I wonder if you are like me, or even my children report this, whenever I've been watching a movie recently and I see people gathering, say, a crowd in a marketplace or a busy street or a workplace, I can't help by saying to myself, hey, they're not keeping 2 meters apart. It seems kind of sad in a way, but we know that with a few more months of continued patience, we can get back to that old way of getting together. For now, it's the Safe 6, in our dreams, in our everyday lives, and even edited into the movies in our minds. Let's keep it that way for now. And that's all for my update. Thank you. Take care of each other. Stay well. Merci, Cho. Merci.
Thank you, Dr. Hanley. Thank you, Premier Silver. We'll now go to reporters on the line. I have John, CKRW, Claudiane, Radio Canada, Haley, Yukon News, Kevin, Media Q, Gabrielle, Whitehorse Star, and Laura, CBC. Is there anyone else on the line that I've missed?
Marine, L'Aurore Boréale.
I heard Marine with L'Aurore Boréale. Who else did I hear there?
Philippe Morin, CBC Yukon.
Merci, Philippe. We'll go to John, CKRW.
Hi. There have been some claims over social media that students in the territory have experienced some burns or irritation, sensitivities to the increased use of hand sanitizer and sanitization products in some of the schools. I was just wondering if anyone can comment on if that's being looked into at all.
Go ahead,
Well, I can say my bit, and then frequent use of a drying agent, like an alcohol-based agent, hand sanitizer, can certainly lead to irritation, especially in some kids who are more sensitive. And often using a moisturizing skin cream, of course, is a good way to prevent that from happening. I haven't heard of anything sort of from a collective or institutional level, but perhaps Premier, you have something to say?
Yeah, I could just add that in our morning conversations amongst the ministers, we had both Minister McPhee and Minister McLean for the Workers' Health and Safety Board, both looking into their department to see if there's any specific issue with any specific products. But it's probably what Dr. Hanley is speaking of, is overuse is definitely irritating my hands, that's for sure. But we're looking to make sure that the products are safe, and we have no reason to think otherwise at this point.
Thanks, John. Do you have a follow-up?
I do. I was wondering if we could get some information. We all know that more cases are probably going to arrive in the territory, and I'm wondering if there's either an amount of cases or a circumstance regarding the cases that would put us back towards heavier restrictions. I understand in the plan that we would go back in the event of an outbreak or such to more restrictions. I'm just wondering if there's a bit more clarity regarding what the threshold is.
I'll just start by, you nailed it right away. I mean, it's the path forward. That's our triggers that puts us forward or backwards, including our abilities for the medical system to not be overwhelmed, working with the communities, making sure that information is flowing. There's 6 triggers, and of course, urging everybody to go to yukon.ca and to see the plan. And I'll leave the specifics about, I know that Dr. Hanley's been asked quite a bit, like, is there a per capita number, these types of things. I think he's been very clear even today talking about the traceability of the cases and jurisdictions, but of course, Dr. Hanley.
Yeah, that's right. I mean, it's always a good question to keep revisiting. So I've spoken to this many times, but I'm happy to continue to do so. But I think that the first thing you were asking is, does it depend on a number? And no, it doesn't depend on a number as long as the pattern remains the same in terms of what we see locally. So again, we anticipated. In fact, I anticipated more cases. Sorry, I forgot to slow down, Mary. I'll slow down my. I anticipated more cases, in fact, as a result of the opening to BC. And as I said, I'm pleased with the low number. But as long as we keep in this mode of case containment, so we can do the follow-up, the case is isolating, it doesn't lead to some of those things that we do worry about, like outbreaks, or especially larger outbreaks, or the onset of community transmission, then we're staying in a good place, no matter whether that number is 17 or 70. If the pattern stays the same, I'm not worried. And then likewise, as we look at other jurisdictions, we continue to look at what are the actual patterns that we're seeing. And so I gave a few of those indications in terms of what we're seeing in BC. Most cases are still traceable to known contacts. Most cases are occurring in localized area and in localized outbreaks. So this is not rampant community spread like we may be seeing in other parts of the world at the moment. So, and even BC compared to some of the other provinces remains in a very stable place, which is why we maintain that, I think, favorable connection with BC in light of their ongoing favorable epidemiology. So I think those are, in addition to what the Premier said, it's laid out in the path forward. Those are a few more of the details around it.
All right, next we have Claudiane, Radio Canada.
Okay, so I will ask in English because I don't know who will answer, but if Dr. Hanley has something to say, I would like also to get an answer in French, if that's okay. So, regarding the disclosure of cases in Skagway, a very small community, relatively speaking, they decided, along with the person afflicted, to disclose the identity of the person in order to fast track and save money on the contact tracing. I am wondering if that is something that could be considered here in the territory, and what sort of rationale for your decision?
Yeah, well, I will try to answer that in English and French, and then if the Premier has anything to add, I'll let him. But that was certainly something that took us all a little bit by surprise, and it's an unusual move. And I think it has to be considered in the context of what is going on in Alaska, where clearly there is a high degree of surge in COVID. Cases are continuing to mount. And there is significant community spread, even in smaller communities in Alaska. And so it's a very different context from what we have now, where our priority is, again, to maintain a robust case management, including contact tracing. I think one of the things I tried to illustrate in today's update and also previous is that we can actually do contact tracing very well. And one of the fundamental tenets, which is why I addressed confidentiality at my last update, is how those two are so well connected. That if we can maintain that trust of confidentiality, then it allows us to get the information that we need in order to pursue contacts and to talk to contacts, and therefore complete those circles of contact tracing. So really, confidentiality is inherent to good and effective and complete contact tracing. And it's hard to separate those two. So I would see that as an exceptional move that may have helped in that particular circumstance, but is not by any means applicable to our context. I'll now give a short summary of that in French. C'était quelque chose qui est arrivé à Skagway qui nous a étonnés parce que normalement la confidentialité, la respect de confidence, c'est intégré avec le gérance de suivre des cas et de faire de bons suivis de cas, incluant le contact tracing. J'ai oublié comment dire ça en français. Donc, ça reste ici. Ici, nous sommes dans une situation, dans un état très distinct, très différent de Alaska, où on reste avec les cas qui on peut continuer de considérer comme le contenu de cas. Donc, on peut isoler les cas, identifier les contacts et fermer chaque cas avec l'investigation des cas pour identifier les contacts. Et confidentialité est une partie très très importante de entretenir la validité et la possibilité de suivre, d'avoir la confiance des gens, d'avoir que si on dit rien, sauf pour les détails essentiels pour la public, on peut rester en confiance avec les gens où on est en contact avec. Donc c'est vraiment une partie très importante de faire de suivi nécessaire pour les cas.
And I'll just I'll just add to that. Thank you, Dr. Hanley. I was really, I heard on the news the interview with the individual in Skagway, and his comments were, on the contrary. I was pleased with a lot of the support I got from the community, and it was really great to hear that, and it kind of made me feel really good about being a Northerner, and of course that's what the communities are going to do in the North, is to reach out and see if this person's okay, that type of thing. But you could also see how it could go the other way as well. And, just for the record, I do not know the names of any of the cases in Yukon. Dr. Hanley does not share that information with us as a government, nor should he. I'm more interested in how the virus works, how it moves, how we trace, and how prepared we are for it. For those reasons, and the fact that things could go in a different direction when names are named, I think that's an extremely important piece of keeping the personal medical information separate from the statistical analysis that we need to make sure that we're keeping other Yukoners safe. I will turn into journalist mode and ask Dr. Hanley if he can explain. I know that they've used the word community spread in Alaska, and I believe that's a different. They use those terms a little bit differently in Alaska than we would here. And if you wouldn't mind expanding a bit on that.
I see the circle of reporters has continued to expand. I'd be happy to. Mais une dernière chose avant de laisser l'autre, c'est que le nombre de temps depuis mars que j'avais la gratitude et le remerciement depuis les gens pour respecter la confidence. C'est plusieurs fois que j'ai reçu ces félicitations pour respecter les besoins ou la famille ou l'individuel ou la communauté pour respecter et garder la confidence. Just to say that it's been a number of times, not just once, that I've received notes or emails of appreciation from individuals or families or communities, for that matter, for having not disclosed and for having maintained that confidence. The question of community spread, if I may, is now, I don't know. I don't pretend to know all the details of the Skagway case. Again, it's not. We also, when we share information from jurisdiction to jurisdiction, it also does not go into the details of individuals and contacts, because again, that's not a necessary part of the conversation. So our conversations are also between jurisdictions about what is the risk and what is the activity going on that speaks to that risk. When the concept of community spread, as used by the municipality, I believe relates to the fact that the first case may not have been related to travel outside Alaska and may have been supposed to have been acquired within Alaska. That is how I'm interpreting how they are identifying community spread, recognizing that it appears the cases identified in Skagway were part of a cluster and they're thus related to each other. So we to be clear about the definition that we use of community spread, it is when we no longer are able to trace the acquisition of COVID by an individual. So in other words, that it appears to have been picked up somewhere in the community, and we see that repeatedly. So we see transmission occurring without being able to link it back to an identifiable case. So you see that used in the provinces for, if you look at their data, they are talking about traceability to known contacts, and then how many or not are traceable to known contacts. The additional nuance here is that we trace our contacts to travel outside. And as long as we are able to trace individuals either directly to travel or indirectly to travel as, say, part of a cluster, then we are we're able to identify those chains of transmission. So identifiable chains of transmission means that we do not have community spread. Community spread is what we typically see with influenza every year. We don't contact trace influenza because it's like the cat's out of the bag. If it's around, it's around. Usually because of multiple introductions, and spread occurs. So we cannot trace each individual case of influenza as to where it comes from, and that is in many areas now outside Yukon. That is also the case with COVID.
Thank you, Premier. Do you have a follow-up? No, just we'll go back to Claudiane. Do you have another question?
Yes, thank you very much for those thorough answers and the extra questions. My second question, same exercise though for the French answer. I'm guessing it's for Dr. Hanley though, and probably shorter. Pharmacies are offering flu vaccines this week. Could we see pharmacies offer COVID vaccines once this one is on?
Yeah, that's a good question, and I would say in an ideal world, yes. I can't say though for sure because it may depend on what products actually we end up with, so I think more to come. I mean, this is great. We're all so happy, the pharmacists themselves, the public, and we in public health are very happy that this is occurring. I think there is a great future for pharmacists to be able to participate with ourselves in vaccination of various kinds. So influenza vaccine is probably the easiest one to begin with. Very straightforward and different levels of criteria needed for being able to be an immunization provider for influenza. So I will say I can't give you a definitive answer yet. It's something that we'll explore. And as we get closer and know what the actual products are and the requirements associated with those products, then we will know better. Donc la question c'est... Oh, André, do I let you? OK. La question c'est pour les pharmacistes pour administrer le COVID vaccin. Et c'est à mon avis, et je peux confirmer avec... la programme, mais c'est trop à dire parce que ça va dépendre sur les produits même et en reconnaissant qu'il y a beaucoup de produits potentiels pour Canada et pour le Yukon. On n'est pas encore dans un état de décider le besoin ou les opportunités pour les pharmacistes de participer. On est très content que les pharmacistes nous joignent pour ce programme d'immunisation pour influenza, mais c'est possible que les vaccins pour COVID-19 sera plus complexe, plus exigeant et donc la place pour les pharmacistes n'est pas encore claire.
Thanks. We'll now move to Haley with Yukon News.
Thank you. I was wondering if we could get a few more details on the contact tracing process. I'm wondering when there are contacts established and you reach out to them, if they're asymptomatic, is that sort of all good? They can carry on, or is there a recommendation for certain behaviors or wearing masks, or are tests required? Wondering.
Sure. I'm happy to explain what I can, and I think probably the key message, I guess, around contact tracing is that it's a risk assessment process. So and that's why we use and continue to use trained and skilled people to do the interviewing that's required. And I think I mentioned this before. I would not trust myself to do contact tracing. I am not trained to do contact tracing. I know the principles, but when it comes back to how you ask a question, how you rephrase a question, how you talk to, other individuals, say family members or next of kin about the case. This is actually, there are manuals for this. There's training and supervision to get the questions right and the technique right. But it really is a risk assessment. So we really, in part of that contact tracing, it's looking at how close, what was the duration, what were the settings of contact, and then really trying to assess basically whether these are low risk contacts or high risk contacts. So there are contacts that are in fact not contacts because they may be so transient. For instance, a few minutes in a grocery store that there is no need to follow up. There are other contacts where the duration may be more significant, but still the contacts fairly casual. That those people may be asked to just simply monitor for symptoms, maintain the low profile that I talked about in my speaking notes about if you're coming back from travel, for instance, but to be careful self-monitoring. And then it's the high-risk contacts. So these are the ones with prolonged contacts. This might be a spouse, household members, people at a gathering that for instance, at a dinner party, like I talked about, where these are considered high-risk contacts, where they may be asked to self-isolate and then to do daily symptom monitoring. When high-risk contacts are self-isolating, they have a daily phone call to check on their symptoms and how they're doing. So it's a very active follow-up for high-risk contacts. Generally, testing of contacts occurs if symptoms occurred. So priority for testing of contacts is symptomatic contacts. There are occasional cases where contacts may be tested if they're asymptomatic, depending on that risk assessment and other factors such as contributing medical conditions and the setting specific contacts, or where it may be difficult to elicit information from that person about whether symptoms are actually occurring or not. So all of that really goes into that package of skilled contact tracing.
Thanks, Haley. Do you have another question?
No follow-up. Thank you.
Okay, we'll move to Kevin with Media Q. Kevin, are you still on the line with us? If not, we'll go to Gabrielle with White Horse Star. Gabrielle, are you still with us?
Hello, yes, thanks. Question for Dr. Hanley. Considering the previous two cases experienced mild symptoms, and that's often the case, does it make you nervous that perhaps there are cases getting missed, and can that be helped?
So it's a good question, and it really doesn't make me nervous. What makes me nervous is people with symptoms who don't get tested. And so remember that really one of the key reasons that we eventually moved, as everyone else has moved away gradually from travel criteria as criterion for testing, it's kind of our safety mechanism. We know that, especially in times like even a few weeks ago, we were 2 weeks to 4 weeks ago, we were seeing lots of kind of mild viral activity in the territory, lots of sore throats, lots of people with just kind of runny noses. We know that these, in our current context, are low risk for COVID. But it's like our early detection. So we're looking for that signal of undetected community spread from that otherwise undetected introduction of COVID into the community. because there are people going back and forth all the time, people coming in. Some of those people might have COVID and never, which never declares itself and never has any impact. But one of those introductions that could occur could lead to transmission to others and be unnoticed. So really, this is, again, our whole strategy is around being ahead of, anticipating that otherwise missed introduction. People do not necessarily declare themselves either to themselves or to others as having COVID. It doesn't light up. It's a detective story, and so part of it is always observing these public health measures, the safe spacing, the safe six, to minimize the impact of the unintroduced spread or the unintroduced the unnoticed introduction of COVID. So and testing is part of that approach. So having a very low threshold for testing is really one of the key ways that we stay ahead of this and stay ahead of that community spread.
Thanks, Gabrielle. Do you have another question?
Yes, I'm wondering also, how is it that the rising case numbers in Alaska are so different from what we're experiencing here and in the rest of the Canadian North, and what can we learn from that?
Yeah, that I know that I'm not going to know all the answers to that, but I think some of the things we see in Alaska are what we see in the United States in general. And we see here the advantages of having very kind of, although we're in different situations in different parts of the country, we also have a very kind of coherent and central-based approach. So we're all doing variations on the same theme. We're really all we all have variations on the public health measures, the use of restrictions, and the shutting down or opening up according to the epidemiology. Clearly, it's being carried out in different ways in different parts of the country, and clearly there are many variations in how COVID has been introduced and many factors that lead to greater risk in the provinces, such as settings where outbreaks can occur much more easily. We don't have meatpacking plants or other industrial settings. We don't have settings where we have large introductions of temporary foreign workers coming in and potentially bringing in COVID infection, as some of the provinces have experienced. So I think in Alaska we see a state where they have not had the opportunity, as we have in Canada, to have a kind of a coherent national approach. I think one of the other factors is they have had they've clearly had different ways of opening up than I think the government of Yukon has, and I know that they did, for instance, go through opening up stages very, very quickly. From, I think, phase 2 to phase 5 happened in a very short amount of time when there was still COVID activity occurring. So I think there was application of relaxing of restrictions that, in retrospect, might be called premature, but I think likely played a role in the later case surge. I think that they also have a number of factors. They have some large urban populations. They have decentralized and different healthcare systems. They don't have the centralized state-run healthcare system that we have. They also have importations of they have a large number of foreign workers who come in for the fishing and the canning industry, and that's a key economic driver and sector in Alaska, and that had led to more introductions of COVID into the state. So I think there were just a number of factors occurring in Alaska that we don't have here. I think that would be a taste of some of them.
Thanks. We'll now go to Laura with CBC.
Hi, Dr. Hanley and Premier. I wanted to follow up. I just realized I'm a speaker. I wanted to follow up on CKRW's question about the cleaning products. I know you mentioned that cleaning products can cause skin dryness, and you have no reason to think they're unsafe. But the Yukon Teachers Association told my colleague that several teachers at at least 5 schools are getting sick and have had to take sick days, and the union suspects it's because of those cleaning products. I'm wondering if the government is looking into this or doing anything in response to the reported illnesses, and if you have a sense of how widespread these concerns are.
Yeah, thanks for the question. I don't have anything more to report as far as what the department is doing. I know that Minister McPhee and her team are looking into the situation, and we want to make sure that all of our teachers and anybody who's obviously using these products to keep everybody safe, that they're using products that are safe to use, and I know that they're looking into it. I wish I had an update right now to tell you more, but I do know that they are looking into it.
I might also add, again, this is news for me to hear, but definitely from the environmental health side, we can help with the departments to follow up on that and make sure that if there are products that are being used that are particularly irritating or problematic, that there can be some advice on the range of other options available.
Thanks, Laura. Do you have another question?
Dr. Hanley, I believe you mentioned today that people should lay low when they return from BC, if I heard correctly. I just wanted to clarify, what exactly do you mean by that? What should people be doing when they return from traveling?
Yeah, thanks for that. It's not to say that people from BC shouldn't do anything that anyone else who is within the bubble can do from a legal or a guidance point of view. It's just to pay attention, to pay extra attention. There are some settings though that are just that we do have requirements in place. For instance, in healthcare settings, people returning from BC as healthcare providers, for instance, coming into the hospital, may be are asked to effectively do working self-isolation. So they may be required to wear PPE, for example, if they're coming to work from BC, even though it's within the bubble. It's just to ensure that we are protecting those areas where we really do not want to see the impacts of a potential introduction. But that aside, what I'm asking people to do is just pay extra attention to that first symptom onset, and make sure that you do what is required, which is to withdraw, to go home, and to get tested. So, and it's to be extra vigilant about attending gatherings. If there are 11 people in an indoor gathering, don't be the 12th person to attend. Make sure that you're extra careful about observing safe spacing. Make sure that if you're going to the grocery store and you're asked to wear a mask, that you wear a mask. So it's to take everything that is written to an extra degree of vigilance. That's really what I mean.
Thank you. We'll now move to Marine Laura Boreal.
Merci beaucoup. Je n'ai pas de questions.
Merci, Marine. Philippe, CBC.
Yes, thank you. I have a specific question. In BC, the Immunize BC website says that there is something called a high-dose influenza vaccine that's being given in long-term care and assisted living care facilities. Do we have such a vaccine in Yukon? I've never heard of a high-dose influenza vaccine before.
Yes, thanks, Philip. Yes, we do. We do have the product available this year for the first time for those in similar settings. So those who are residents of continuing care facilities will be offered this particular product, which is the high dose flu vaccine product. So it's a dose that has more of the antigen. It has 4 times the amount of antigen than the regular dose. So it has what I would say is likely a modest added benefit, and is a potential advantage for those who are more vulnerable to complications of influenza, such as our elderly. I do want to say, though, that the effect is modest and that there is a certain amount of trade-off. So it's not something that I necessarily recommend for the wider public. So 2 examples of that. One is the relative. There is a degree of relative effectiveness, but when you look at the absolute effectiveness in studies of the high dose product versus other products, it's actually quite a marginal benefit. So it's kind of a way of giving benefit to the doubt of the people that we are most worried about, and that's the people in residential facilities and long-term care. The other trade-off part is that the high-dose product is a trivalent. It covers for 3 influenza variations, 2 A's and 1 B, which used to be our standard product. We now have quadrivalent products. So the product that is being offered, for instance, at the public flu clinic is what we call the quadrivalent product, 2 A products and 2 B products. Now, again, there's a lot of arguing back and forth about this. There is some cross-reactivity that the Fluzone trivalent product has with the other B that is missing compared to the quadrivalent, but there still is that kind of slight trade-off. So the single most important thing is to get the flu shot, no matter what the product is. The variations between one product to another are maybe not quite academic, but modest at best.
Thanks, Philippe. Do you have another question?
And yes, thank you. And just quickly to clarify, do people need to ask for one or the other, or will the healthcare provider know which one to provide? The product that will be offered at long-term care is the high-dose product. So that is the product that will be given. They do not need to ask for that. That will be given. The product available at the public flu clinics is the regular quadrivalent product, along with the flu mist for those who fall in that age category. If the 2 years old to 17-year-old without immunocompromising conditions, they have the option of asking for flu mist, or if they prefer, they can have the injectable product.
All right. I'd like to thank everyone for their time today. Our next COVID-19 update will take place on Wednesday, October 28th at 11 a.m.